Bruce Lee brought martial arts to the attention of the Western world and popularized the phrase, "Be water, my friend." Lee died on July 20, 1973, in Hong Kong at the age of 32 under mysterious circumstances. The cause of death is unknown, but numerous hypotheses have been put forward, ranging from assassination by gangsters to a more recent suggestion put forward in 2018 that he died from heatstroke. The autopsy showed cerebral edema. He had also been diagnosed with cerebral edema 2 months earlier. Now, based on the analysis of publicly available information, we suggest that the cause of death was cerebral edema due to hyponatremia. In other words, the kidney's inability to excrete excess water caused Bruce Lee's death. Bruce Lee was the most influential martial artist of all time. He inspired millions of people and brought martial arts to the attention of the Western world. He was born Lee Jun-fan on November 27, 1940, in San Francisco, California, while his father, an opera singer, was on tour in the United States. As a baby, he returned with his family to Hong Kong and worked as a child actor. He began learning martial arts at age 13. At 18, he returned to the United States, where he studied drama and philosophy and opened a martial arts school. At 26, he appeared on American television for the first time as a martial arts fighter. Lee created his own fighting method, which he called Jeet Kune Do, or the way of the intercepting fist, combining different training methods such as kung fu, fencing, boxing, and philosophy. He popularized the philosophical quotes beginning with, "Be water, my friend." At 29, he returned to Hong Kong, where he became a writer, director, lead actor, and fight scene choreographer. Lee died on July 20, 1973, in Hong Kong at the age of 32 under mysterious circumstances. The cause of Bruce Lee's death remains unknown to this day, but numerous hypotheses have been put forward, ranging from assassination by Triad gang members to a more recent suggestion put forward in 2018 that he died from heatstroke. The facts. Some facts about Bruce Lee's death are a matter of public record. On the day of his death, he and his film producer Raymond Chow went to the home of Betty Ting Pei, believed to be Lee's mistress. Lee spent a few hours alone with Ting Pei and used cannabis before heading home. While there, he actively acted out some scenes from an upcoming film. At around 7:30 p.m. after drinking water, he experienced a headache and dizziness. Ting Pei gave him an Equagesic pill, a combination of meprobamate and aspirin, which she had previously obtained, and Lee went to the bedroom to rest. Raymond Chow left at that time. At 9:30 p.m. Ting Pei found Lee unconscious. She called Chow, who also went to the house and tried to wake Lee, but was unsuccessful. They called a doctor, who unsuccessfully performed cardiac massage for another 10 minutes. Lee was taken to the nearest hospital and pronounced dead there. The autopsy showed no signs of external injury or tongue bite. Severe cerebral edema caused the brain to weigh 1575 g, compared with a normal 1400 g. Cannabis traces were found in the stomach. Bruce Lee's death was officially accepted as resulting from cerebral edema due to hypersensitivity to Equagesic. Theories about the cause of death. Among the many possible and improbable causes of death, 3 deserve discussion. Cerebral edema from hypersensitivity to Equagesic. Hypersensitivity to the components of Equagesic was established as the official cause of death. However, Lee had taken this drug before, and on the day of death, he took it after feeling unwell, after showing symptoms that could be explained by cerebral edema, and if hypersensitivity to Equagesic were indeed the cause of death, cerebral edema would not be expected to be the only autopsy finding. Epilepsy. A seizure was considered as a possible cause of the event described below on May 10, 1973, but epilepsy was not diagnosed because it was a single event. On May 29 and 30, 1973, Lee underwent a complete neurological evaluation by neurologist David Riesbord, which revealed no abnormalities in brain function. However, phenytoin was prescribed and Lee took phenytoin until the day of his death. Martial artists are at risk of head trauma or even microtrauma. The most important direct cause of death related to epilepsy is sudden unexpected death in epilepsy, which is more common in patients with chronic epilepsy. Forensic reports may include tongue bites, cerebral edema, and pulmonary edema. The absence of a history of chronic epilepsy, being on antiepileptic drug treatment, and the absence of tongue bite at autopsy argue against this diagnosis. Heatstroke. This latest hypothesis on the cause of death was put forward by Matthew Polly in his 2018 book Bruce Lee, A Life. Heatstroke is a condition associated with a core body temperature above 40 degrees Celsius, hot, dry skin, and central nervous system abnormalities. Matthew Polly suggested that Lee's removal of his armpit sweat glands a month before May 10, 1973, could have increased the risk of heat stroke. However, sweat is produced from most skin surfaces. Therefore, removal of only the armpit sweat glands is unlikely to facilitate heat stroke. Polly also suggested that the May 10, 1973 event was likely due to heat stroke and that both days were unusually hot for Hong Kong. However, despite the removal of the armpit sweat glands in the May 10 event, excessive sweating was described, and temperatures of 25 degrees Celsius and 32 degrees Celsius on both days are common in Hong Kong. Overall, the time course, the ability to sweat, the absence of extreme weather conditions, and the absence of reports from witnesses of excessive heat or skin temperature or dry skin despite a hot environment argue against heat stroke. Causes of cerebral edema. Any hypothesis on the cause of death must explain the autopsy finding of cerebral edema without other evidence of central nervous system damage and the acute course of the terminal illness. There are four main pathophysiological mechanisms of cerebral edema. Hyponatremia stands out as a serious possibility that could explain the cerebral edema and the course of the illness, as it is widely recognized that acute hyponatremia itself can be fatal if not treated promptly. Water homeostasis. Water balance in the body is regulated by plasma osmolarity. Increased plasma osmolarity is sensed by osmoreceptors in the hypothalamus, which regulate both antidiuretic hormone release and thirst. Serum sodium concentration reflects water balance. Natremia is the largest contributor to serum osmolarity. The adaptive capacity of the kidneys is great. Hyponatremia rarely develops unless the rate of water intake is clearly higher than this rate of water excretion or there are predisposing factors limiting the kidney's ability to excrete water. Potentially relevant past personal history for the cause of death. The presence of predisposing factors that impair water excretion by the kidneys is the most common cause of hyponatremia. Did Lee have predisposing factors for hyponatremia? A brief overview of publicly available information shows that this was the case. Previous episode of cerebral edema. Lee had suffered his first episode of cerebral edema 2 months earlier. On May 10, 1973, Lee was doing a dubbing session in Hong Kong. They took him to Baptist Hospital, where he was diagnosed with cerebral edema and treated with mannitol. Lee recovered. In his book Unsettled Matters, Tom Bleecker notes that during the investigation into Lee's death, Dr. Karpman said that the blood urea nitrogen at Baptist Hospital was 92 milligrams per deciliter. Therefore, it was understood that Lee had suffered acute kidney injury and that kidney dysfunction was a risk factor for hyponatremia. Excessive water consumption. Lee's wife Linda mentioned a liquid-based diet. On the evening of Lee's death, Polly repeatedly mentioned water consumption throughout the day, including just before Lee became noticeably ill. Excessive fluid consumption appears to have become a habit for Lee. Cannabis. Bleecker reported that Lee used multiple drugs and multiple sources indicate he frequently used cannabis or marijuana, including on his final day. On the evening of Lee's death, Polly repeatedly mentioned cannabis use throughout the day. Cannabis causes thirst and may have increased water intake despite putative hyponatremia. Alcohol. Alcohol use has been associated with an increased risk of hyponatremia. There are reports that Lee's alcohol consumption increased in the last months of his life. Low dietary solute intake. The association of excessive alcohol intake with hyponatremia is partly related to low dietary solute intake. Indeed, there is evidence that in his last months, Lee's solute intake was low and his water intake was high. An abnormal dietary pattern was observed by doctors. Bleecker notes, Dr. O advised Bruce to start eating a balanced and proper diet, and according to Linda, in the last months of her husband's life, he had stopped eating solid food and was living miserably on carrot and apple juice. Prescription drugs. Prescription drugs may be the primary cause of severe hyponatremia. Bleecker writes that during the investigation, he quickly became bored with the complex scientific analysis of the wide variety of prescription drugs Bruce was taking. This indicates the use of other prescription drugs that could have an impact on susceptibility to hyponatremia. These include diuretics, phenytoin, and painkillers. Diuretics. Diuretic use may have contributed to both acute kidney injury and hyponatremia. Bleecker notes, Bruce frequently used diuretics. Although this greatly reduced the excess water content in his muscles, giving him the desired muscular look, it was a dangerous practice that frequently put him in a life-threatening state of dehydration. Opioids. Lee was taking phenytoin and diloxine. We did not find any reports on dextropropoxin and hyponatremia, but other opioids such as tramadol can cause hyponatremia. Antiepileptic drugs. Various antiepileptic drugs can predispose to hyponatremia. The risk of hyponatremia has been reported to be high for carbamazepine and phenytoin when newly started antiepileptic drugs are used. Renal dysfunction. Lee appears to have suffered acute kidney injury during his first cerebral edema episode and subsequently recovered. Acute kidney injury can affect various kidney functions, including water excretion. Exercise. Exercise-associated hyponatremia is defined as hyponatremia occurring during or up to 24 hours after prolonged physical activity. The exercise Lee did while actively acting out some scenes on the last day of his life could be an additional contributing factor to exercise-associated hyponatremia. Summary of evidence. The answer to the question of whether Lee had factors predisposing to hyponatremia is yes. He had not just one but multiple factors predisposing to hyponatremia. Chronic high fluid intake. Factors acutely increasing thirst and water consumption. Cannabis and evidence of repeated water drinking on the day of death. Factors decreasing the kidney's ability to excrete a water load. Prescription drugs, alcohol, chronic low solute intake, acute kidney injury observed in May 1973, and exercise. In summary, Lee had multiple risk factors predisposing to hyponatremia resulting from interference with the water homeostatic mechanisms regulating both water intake and water excretion, a clinical picture consistent with hyponatremia, and the autopsy finding of cerebral edema, which is the cause of death in severe hyponatremia. In conclusion, we hypothesize that Bruce Lee died from a specific form of kidney dysfunction. The inability to excrete enough water to maintain water homeostasis, a predominantly tubular function. This can lead to hyponatremia, cerebral edema, and death within hours if excess water intake is not matched by urinary water excretion, which is consistent with the timeline of Lee's death. Given that hyponatremia is frequent, found in up to 40% of hospitalized individuals, and can lead to death from excess water intake even in young healthy individuals, the concept that excess water intake can be lethal needs to be more widely disseminated. The fact that 60% of us is water does not protect us from the potentially fatal consequences of drinking water at a rate faster than our kidneys can excrete the excess. Ironically, Lee famously popularized the phrase, "Be water, my friend," but excess water appears to have ultimately killed him.